So thank you everybody for joining us this afternoon. This is really a very important initiative to us, and one that we hope will be valuable not only in furthering uh, Rhode Island's public health emergency preparedness initiatives, but also in terms of better establishing connections between uh, very real needs and concerns at all levels of the state, local, community, and state, with those that we've ourselves have identified. So again, thank you. Welcome to Rhode Island's 2025 Public Health Risk Assessment Kickoff Introduction. So this represents one of the Rhode Island Department of Health's first formal initiatives to synthesize the important efforts to understand risk within the emergency management and healthcare sectors, with additional data and input from a range of internal and external colleagues, subject matter experts, community leaders, and other key partners who offer a public health perspective. It is the Department of Health's hope that this risk assessment complements those existing efforts to understand and manage risk by providing additional public health context that may not have been previously considered. The findings from this risk assessment will also help inform the Department of Health's emergency preparedness priorities over the next several years. So again, we very much appreciate your time and participation in this important effort to help inform and guide the Rhode Island Department of Health's emergency preparedness priorities. In an effort to capitalize on some of the lessons learned during the recent COVID-19 response, we are working in earnest to explore and implement meaningful ways in which to engage community partners for input at the front end of various development processes. And this public health risk assessment process is one of our first opportunities to implement some of those practices. So again, thank you very much, and we will get going here. So today's session. Yep,
You need to slow down just a little bit, please.
thank you. All right, so today's kickoff session serves as an introduction to this project and the survey tool that will be used to collect your thoughts and input. The session will cover the following topics: an overview of the risk assessment concept and how it's traditionally performed, what makes a public health risk assessment different, what other risk assessments in Rhode Island have found, the threats and hazards that will be considered in the Rhode Island Department of Health risk assessment, the goal of Rhode Island's public health risk assessment, and how we can think about public health consequences in order to conduct our public health risk assessments. It'll be followed by a brief overview of a survey that we hope to use to collect your individual thoughts and feedback and input in this process. And we'll also talk briefly about how findings from this risk assessment will in turn inform the Rhode Island Department of Health's future emergency preparedness priorities. So, what is a risk assessment? A risk assessment is a systematic process of determining the risk posed by various threats and hazards. Risk can generally be understood as the possibility of negative impacts that could come from a threat or hazard, like a hurricane or flood. So, a risk assessment seeks to better understand risk by looking at a number of factors, including the likelihood or probability that a threat or hazard occurs, the impact that the threat or hazard would have if it does occur, actions or measures that have been taken to either reduce the possibility that a threat or hazard occurs or reduce the negative impact of the threat or hazard if it does occur. So what sets a public health risk assessment apart from traditional risk assessments? Most risk assessments tend to look at the impact of threats and hazards in terms of lives lost, interruption to operations, and financial cost. A public health risk assessment, on the other hand, instead looks at impact in terms of the public health and medical effects of various threats and hazards. For instance, rather than simply focusing on the number of lives lost from a potential threat, a public health risk assessment could also consider increased injuries or illnesses within a population, damage to the environment, again recognizing the connections that exist between environment and public health, interrupted access to medical care, effects on the social determinants of health, for instance, things like access to quality education and healthcare, impacts to neighborhood and built environment, impacts to job security, and other factors that have effects on public health. So, in order to better understand the landscape as it exists, I'm going to review some of the findings from some other risk assessments that have been conducted here in the state. So this first slide depicts findings from the state of Rhode Island's Hazard Identification and Risk Assessment, also known as the HIRA, H-I-R-A. So the HIRA collects information from local emergency management agencies about the threats and hazards that their own communities face. This information is used to determine the most prevalent threats and hazards facing the state as a whole. The HIRA shows the threat or hazard along with its corresponding planning significance, like you see here on the slide. The planning significance is based on how likely it is that the threat or hazard will happen and what kind of impact we expect the threat or hazard to have. Local emergency planners and managers in turn use this information to inform their own planning efforts and risk mitigation efforts as they move forward. So as you'll see here on this slide, there are a number of threats and hazards listed. They include threats and hazards which traditionally fall within the natural disaster category, as well as threats and hazards that may come as a result of either infrastructure failure or accidents, as well as intentional, perhaps criminal or terroristic activities. As you see here in the rightmost column, there is planning significance associated with each of these threats and hazards. Again, that planning significance speaks to the risk posed by those threats and hazards. So you'll see up at the top, flooding that has been identified by subject matter experts here in the state as posing the highest risk among this set of threats and hazards to Rhode Island. Conversely, terrorism, which we see at the bottom, represents the lowest risk posed to the states. So that was one example of a risk assessment that is routinely conducted here in the state. Another example can be found within the Healthcare Coalition of Rhode Island's work to prepare the healthcare sector to respond to a wide range of disasters and emergencies. So just like emergency management agencies collect information on the threats and hazards they think are most likely to impact their communities, hospitals, long-term care facilities, community health centers, and other healthcare organizations consider the threats and hazards that would impact them. So this slide shows a list of the threats and hazards identified through the Healthcare Coalition of Rhode Island's annual Hazard Vulnerability Assessment. The Healthcare Coalition of Rhode Island, for those who may not be immediately familiar, is Rhode Island's single emergency preparedness and response coalition for the healthcare sector. It includes membership not only of hospitals, health centers, long-term care facilities, and a wide range of other healthcare facility types, but also emergency medical services, emergency management, and an array of non-traditional healthcare partners. This list is presented in descending order of relative risk. So up at the top, leading with inclement weather, has been identified by partners within the Healthcare Coalition of Rhode Island as the threats that poses the most significant risk to their various organizations. Down at the bottom, at entry number 63, is landslide. That has been identified as posing the least amount of risk to healthcare organizations in Rhode Island. So you'll see on this slide a number of parallels with the previous slide in terms of the threats and hazards that are considered. You'll note in this list a number of threats and hazards that could have effects at the community level. For instance, inclement weather or a pandemic will understandably have effects that extend beyond any one healthcare facility. However, inside this list, you'll also note a number of threats and hazards that really probably would only affect a singular healthcare facility, for instance, an internal fire. This is important information for us to consider, even though it may affect only a single healthcare facility. You can imagine the cascading impacts that might occur if, for instance, one of our more critical facilities was rendered inoperable by, for instance, an internal fire. So these are again, these are threats and hazards identified by the healthcare sector. Very important for us to keep in mind as we consider things from a public health perspective. So in order to conduct this public health risk assessment, we have sought to leverage the threats and hazards identified in both of those primary risk assessments, again, the hazard identification risk assessment and the hazard vulnerability assessment that's conducted by the Healthcare Coalition of Rhode Island, to identify the threats and hazards that are most likely to produce significant public health impacts. So this is a list of threats and hazards that we have come up with for our risk assessment here. You will see that they also include a range of types of threats and hazards. We have a number that fall within the bucket of natural hazards. Those are your traditional natural disasters, things like droughts, earthquakes, hurricanes, tropical storms. We also have a number of technological or unintentional hazards that we perceive to have the potential to result in widespread impacts, either at a community or a healthcare system level. Those include things like a communication system failure, cybersecurity events or incidents, dam failure, large-scale drinking water disruption or contamination. And we also have a number of threats and hazards that are considered traditionally as being either intentional threats or deliberately human-caused threats, including obviously acts of terrorism, active shooter events, bioterrorism, and a number of other threats and hazards. So very generally, the goal of the Rhode Island Public Health Risk Assessment, why we're here today, is to identify the threats and hazards that present the most significant public health impacts or consequences. So, in order to capitalize off of this work, the Rhode Island Department of Health will work to align its emergency preparedness priorities and activities with the threats and hazards that are identified through this process, working to focus efforts related to planning, training, and exercises around the threats and hazards that present the most significant risk in terms of public health impact. So, in order to effectively conduct this risk assessment, it's important to reach a common understanding of what is meant by public health impacts so that we can assess the potential of these threats and hazards to produce them. So, what do we mean by public health impacts? So, as mentioned earlier, public health risk assessments differ most significantly from traditional risk assessments in terms of the impacts they seek to measure. Instead of focusing on lives lost, interrupted operations, and financial cost, public health risk assessments instead consider impact in terms of public health and medical implications. So, for our particular risk assessment, we are going to be focusing on the following factors to determine the risk of the impact and associated risk with each of these threats and hazards. So we will be focusing on increased risk of morbidity and mortality, so higher rates of injury, illness, including not only physical illness, but also behavioral health effects, as well as mortality or increased numbers of deaths. We will also examine the potential of these threats and hazards to compromise healthcare and public health infrastructure, focusing not only on the traditional healthcare and medical facilities that make up public health and healthcare infrastructure, but also some peripheral infrastructure like drinking water systems, food supply infrastructure that play really critical roles in supporting the public health of a community. We will also examine the potential of these threats and hazards to damage the environment, again recognizing the interconnections between the environment, animal health, and human health, and the cascading impacts that could occur related to public health if the environment is significantly damaged. And finally, we will also examine the potential of these threats and hazards to compromise structures and supports related, structures and supports related to the social determinants of health, considering factors like housing stability, access to healthcare and quality healthcare at that, economic stability, and impacts to neighborhoods and built environments. So, sort of the centerpiece of all this is a survey that we intend to share with you. I believe that Jake has already put a link in the chat. We have, just like this current presentation, 3 different versions of this survey. We have one in English, one in Spanish, and one in Portuguese. You will note that the survey structure is very similar to the considerations that we just went through. So in the survey, you will be presented with the full list of hazards that we saw on the previous slide. And with respect to each threat and hazard on the list, we're going to be asking you to consider the following factors related to each. So first, we'll consider how likely it is that each of these threats or hazards could occur. You will have the opportunity to identify whether you feel that over the course of the next 12 months, these threats, each threat and hazard is either very unlikely, somewhat likely, or very likely to occur. Next, we will look at the types of impacts that each of these threats and hazards could pose to Rhode Island. First, we will be looking at impacts related to health of people in Rhode Island. So thinking about how threats or injuries might result in increases in injuries, illness, or death. You'll have the opportunity to rate that potential on a scale ranging from insignificant to severe. We will then consider the impact that the threats and hazards have on the environment, again, considering factors like the potential for threats and hazards to cause pollution, contamination, harm to wildlife, or opportunities for increased wildlife-human interaction, which could conceivably lead to risk of exposure to various diseases that may be present among animal populations. And here too, you will have the opportunity to rate the potential for each of the hazards on a scale ranging from insignificant to severe. Following that, we will consider effects on the social determinants of health posed by these threats and hazards. Again, considering factors related to changes in access to education, changes in the quality of available health care, job security, and other considerations related to social determinants of health. Here too, you will have the opportunity to evaluate each threat and hazard and provide a rating ranging from insignificant to severe. Next, we will look at the impact that threats or hazards have on the physical public health and healthcare infrastructure here in the state. So thinking about potential damage to hospitals, doctors' offices, health centers, drinking water systems, childcare, and a range of other types of infrastructure. Again, thinking about the potential for threats and hazards to result in damage to infrastructure within the sector, perhaps rendering facilities unable to operate normally, which understandably could have a detrimental impact to public health. And then finally, you will have the opportunity to provide some insights into how prepared you feel Rhode Island is to respond to these threats and hazards. That will factor into the equation that is used to calculate risk. So it's important for us to consider what measures might already be in place in order to reduce the risk posed by the various threats and hazards. So, again, after the survey, we intend to leverage the findings collected from this effort to better inform our work moving forward. We are not only engaging all of you today, we have some other sessions scheduled to gather feedback and thoughts from a range of internal and external subject matter experts. After we have collected information through these surveys, we will work to summarize the findings and create a report that outlines not only the threats and hazards that present the most significant public health risk, but also the populations and areas of the states that may be most susceptible or at highest risk from the impacts associated with these threats and hazards. The top 5 threats and hazards in this identified through this assessment will receive a rather special attention and focus in our emergency planning, training, and exercise activities over the next several years. So your input in this process is truly invaluable to us for us to ensure that we have alignment with not only what we perceive to be the threats and hazards facing Rhode Island, but those that you recognize as well. I went through things rather quickly. I'm hoping now that we can open it up if there are any questions that anybody has. I believe that Jake has put into the chat links to each of the surveys. It is our intent to leave these surveys open for the month of October. So they are in fact open now. So please, at your earliest convenience, feel free to pop in there and respond to your survey. There is a functionality in the survey. It should take about 25 minutes to complete, but if you're unable to complete it in a single sitting, there is a functionality in which you can leave the survey and resume later. You'll have to supply your email address so that it sends you a link in order to access the survey to resume it. So I don't know if anybody has any questions, thoughts, comments, concerns about anything we just went through. Okay, not hearing any. My email address I will put in the chat right now. It is, please, if you do have any questions that occur to you, certainly after this meeting or as you work through the survey, please don't hesitate to reach out. Similarly, if you have any difficulties with the survey, if you, for instance, go into the survey and you leave it and you're unable to retrieve it to resume your work, please don't hesitate to reach out and we will get you set up. Thank you again very much, everybody, for attending this afternoon. It is really important and we very much appreciate it. And many thanks to our interpreters who supported us on our call today. Very much appreciate that as well. I'll stay on the line for a few minutes in case anybody has any questions. But again, thank you so much for your time today. We really appreciate it.